Private treatment has access to the best treatments in the world, irrespective of cost. Some of the time, we have to make a solution for a patient which is an affordable solution for their diabetes. But some of the time, their risks for blindness, for kidney failure, for heart attack are quite serious. Their life expectancy is not normal. And I think they need to be told that there are options, often expensive options, that would actually turn their health round. So the private sector gives you a choice. It enables you as a patient to discuss with your doctor what is best for you. And then you have to decide whether you wish to afford a change or not. Some of the time we act as a pressure point for the NHS, who actually quite often are helpful on our advice in making expensive treatments available for our patients. But where this is not possible, and I think increasingly there's going to be a gap between the NHS, what the NHS can afford and what can be purchased in the private sector, a patient will have the option of providing this, getting this care in the private sector. I remember 10 years ago, 15 years ago, we were the first clinic to offer treatments for age-related macular degeneration. And there were very old people, 95, coming here for the treatment, and their sons would pay for it. Because by the time the NHS got round to offering it as on the NHS, they wouldn't be alive. So they basically paid for it privately. So sometimes patients can't wait until the NHS gets round to offering them what they need to do. And I think if you're in a hurry, if you're a type 1 diabetes patient and you're young and your eyes are going to inevitably lead to blindness, that's a very, very serious thing. And I think quite often the family as a whole come together to help afford treatments that they know will make a difference.